be honest, now at the point where it's every week where I'm catching a patient that I probably otherwise wouldn't have caught as having a nerve-related musculoskeletal pain, where I would have previously just diagnosed it as a tendinopathy. Plantar fasciitis, Achilles tendinopathy, super common, that there is a neurodynamic component to that. There's some research to indicate that plantar fasciitis, for example, and this would be a low end estimate, that somewhere around like 35% of patients with a confirmed diagnosis of via ultrasound of thickening and inflammation of the plantar fascia that is consistent with plantar fasciitis also have a nerve conduction study that confirms a medial calcaneal neuropathy. And that's with ultrasound confirmed plantar fasciitis. And then you have to imagine like those who don't have ultrasound confirmed plantar fasciitis is probably a higher number. So there's a significant percentage of people out there who have the characteristic presentation and exam findings of plantar fasciitis, who have a neurodynamic component to their chief complaint pain as either a primary driving mechanism for that pain or at least a confounding factor. And my experience is it's often primary, or if not primary, the confounding factor of having a secondary neurodynamic problem related to plantar fasciitis. If you don't address the neurodynamic problem, the plantar fasciitis won't get better, because as long as that nerve is inflamed or irritated, it's going to create the neurogenic inflammation that then affects the plantar fascia. So you can do all the loading you want, but if you don't address the nerve, it's just going to come right back. And again, in retrospect, for sure, many of my patients back over the years who were like slow or non-responders in the realm of tendinopathy were probably neurodynamic in nature.